And welcome back to Open Line. We are asking the expert this evening. The expert here, Dr. Christopher Sandlin from Bluegrass Endodontics. He's an endodontist. A lot of times people I know think of the endodontist when they have a root canal. Their dentist refers them, and this is the man that you would go and see. But we've basically been talking about a lot of things to do with just proper mouth care. So I'm going to get into a question that I had for you, but we are going back to the lines right now with us. Molly, thanks for joining us this evening. Do you have a question or a comment?
Yes, I have a question and maybe a comment. When I lived in Palm Springs, California, this was in the 1960s. It would be 66, 67, 68. I went to a dentist, and he did on the bottom teeth, the last three on the left side. He put crowns on those three teeth, and he burned the gum level. Of course, I'm 83 now, but he burned the gum around the teeth before he put the crowns on, and I asked him why he did that, and he said to cover so that it would not decay if he went down lower, that was the best way to do it, and that these would last for a long, long time. Well, it's 2015, and those teeth have been perfect, those three crowns. Other crowns, I've had decay below, you know, at the bottom of them, like between the bottom of the crown and the gum line. But these three have really not. Why do dentists not burn the gum level down and put that crown down lower so that you don't get decay below the? That's my question.
All right, interesting question.
Yeah, that's really interesting. What we generally don't want to do is put restorations way down below the gum line. We want to have a limited amount of gum tissue that kind of circles that restoration or that crown margin. As you start to develop this larger turtleneck, as I call it, of gum tissue around that tooth, it effectively will hold more debris from your mouth, bacteria, plaque, things like that. So by reducing that pocket around the tooth or around the edge of the crown, you're effectively reducing the size of that turtleneck of gum tissue that can hold stuff. Sometimes when we place restorations, even as an endodontist, when we do build-ups, we'll electrosurge or we'll cauterize that tissue to effectively reduce the size of that pocket. That makes your home care, cleaning the margins of those restorations, much easier and much more effective.
Well, thank you very much for your input, but it seemed like the gum, you know, grew back around the tooth. It never, you know, wasn't very much. But I just thought that was a wonderful way to do it, because those are the only three crowns that have lasted.
Well, I think you probably should give yourself a little credit. If you've held on to them for that long, you're probably doing something right.
Well, I got a lot of others, though. Thank you for your help.
You bet. Thank you so much, Molly. Have a great evening.
Bye.
Bye-bye. So, interesting. And I guess, you know, look, everybody's probably their mouth, there's just the makeup, everything is just different.
Like I said before, some people, the way the chemistry of their mouth and the saliva and the chemicals there, some people's mouths are more prone to an acidic makeup, and they're more likely to have cavities and not get tartar buildup. Some people never get cavities, and every time they go to the dentist, the hygienist is scraping and scraping. A lot of that has to do with the chemical makeup and also your diet, the makeup of your diet and the sugars that are in your diet.
I want to ask you about that. Now, if you're just tuning in, just to let you know, you're watching Open Line, and we are talking about your teeth with endodontist Dr. Christopher Sandlin. As far as foods that you eat, are there certain foods that you recommend that are just good for your teeth health?
Well, the fibrous, you know, apple a day, you know, things like that. It's more the stuff that you want to stay away from, the sticky, the sugary, the refined carbohydrates. Those are the things that really kind of latch onto your tooth and give that bacteria fuel to really produce the acid that actually causes cavities.
Okay. Now, the second part of the question I was going to ask you a little bit earlier, we were talking about mouthwash. Mouthwash does not replace brushing your teeth, but after you brushed your teeth, I was asking you during the break, when I've had a sore or something like that in my mouth, I've just felt like I needed to do something more to help the healing, to speed the healing. And so I will use mouthwash after I brush my teeth. Does it speed the healing, or is it just helping you have better breath?
Well, it definitely helps you with better breath.
Right.
As far as the healing, I haven't seen studies that correlate that. In fact, a lot of the mouthwashes on the market today, have alcohol in them, and that tends to burn the tissue. So if anything, if I had to guess, it may decrease the bacterial load on one hand and yet kind of burn the tissue to a certain degree to the other. But for the most part, lesions in your mouth, the little traumatic ulcerations, the little aphthous ulcers, those are going to take time to heal no matter what you do. It's just going to take time.
Okay. Also, when it comes to just taking proper care of your teeth and your mouth, we always hear to floss. I was watching a morning talk show the other day, and there was a panel, I think, of 5 hosts, and they were all talking about who flossed and how often and that sort of thing. And surprisingly enough, only one person on that panel flossed every day. The others said they flossed anywhere between, once and twice a week. Somebody said once a month. How important do you feel flossing is on a daily basis?
Well, I'll be the first to admit, and I tell patients this, when I ask them how do they floss, I'll generally start the conversation by saying I don't floss as much as I should. I floss, every day, every other day, and for different people, depending on how their teeth fit together, the crowding situation, their diet, their propensity to build up tartar, their propensity for periodontal disease, flossing carries a different importance. Now, as you get older, your teeth become more sclerotic. The hard part of the tooth becomes more impervious to decay, but you're more susceptible to periodontal disease. So as I generally tell people, as you age, the need for you to develop that good habit becomes more important.
And how often would you just recommend flossing? Would you recommend it every day?
Every day.
And if somebody doesn't floss every day, though, and they say that, and I've even heard people say they go to the dentist and they floss 2 or 3 days before they go to the dentist,
right,
for their 6-month checkup, and the dentist says, your gums are doing fine. Is there a reason that it's appearing to be okay?
That gets back to the previous conversation. Some people are just fortunate in that regard. I feel like I brush and floss better than my wife, yet she has had fewer cavities than I have. And then there's a wide range when people say, I floss. Well, are you flossing correctly, or are you just popping it between the tight spot? I mean, there's a wide range. So does that answer the question?
Yeah, I think it does. Yeah, so it basically, floss every day is your recommendation.
That's the recommendation.
Yeah, that's the best thing to do. Now, when we talk about going to visit the endodontist, a lot of times it's because your dentist has checked you out and realizes that you do need to have a root canal, and that's why you would go to see Dr. Sandlin. When you go to have a root canal, though, or before you go to the dentist, are there signs that you may have a root canal, and if so, what are they?
Generally speaking, a lot of it starts with sensitivity to temperature. And this is an above the normal generalized, oh, that doesn't feel comfortable when I eat ice cream. I'm talking about when you get a hypersensitivity, something that lingers longer than normal, when you start avoiding certain parts of your mouth because you don't want that cold water or that hot beverage to touch that tooth. Those are usually some of the first indicators. Now, if you can get to your dentist in a timely manner and he can address the source of that sensitivity, and usually it's decay, remove that decay, while that might make the tooth more sensitive in the short run, it may give that pulp a chance to back away and heal itself and avoid the need for a root canal. But when you get to the point where that temperature sensitivity is lingering, or it's spontaneous in nature, that's kind of a cue that that pulp is probably endured more than it can handle, and it's eventually going to die. It's what we call an irreversible pulpitis, and then a root canal is in the cards.
So, but that's good to know that if you start feeling some sensitivity and you take care of it fast enough, it may prevent you from having to have a root canal. So basically, you need to be aware, and when you have certain signs, go see the dentist, or take a visit to your office and check that out too.
And it's a frustrating situation for me, and for the patient, because a lot of times they'll go to the dentist and the dentist will say, you need to have this done, but my tooth is not hurting. And then they do the filling or the restoration of the crown, and then lo and behold, now the tooth does hurt. And so it's kind of this snowball effect. But the reality is, if you don't follow the directions and the guidance of the dentist or the endodontist, it's not that you're going to continue in this asymptomatic way. Eventually, it is going to start hurting you spontaneously. So by seeing the dentist and taking care of the cavity or putting the crown on, it may cause it to be more sensitive than it was before in the short run. But if that pulp can endure that trauma, it can calm down and avoid the need for anything more invasive like a root canal.
Okay. Now, we talked at the top of the show about how far we've come, and root canals are not near the trauma I think that some people have thought that they were in the past. What is involved, though, in a root canal? I mean, are you in and out in a day? I mean, what is the situation?
Well, a lot of that depends on the preoperative diagnosis. What condition is the patient in when they show up? If they come in and they say, I can't eat ice cream because it hurts, I can numb you up, test the tooth with cold to prove to you that you're numb, do the root canal, and then when anesthetic wears off that night, you go home and eat ice cream and it's not a problem. It's immediate. If you wait to see the endodontist until after that tooth has died and developed an abscess, then yes, you can expect some postoperative discomfort. It may be sensitive for a couple of days. It may temporarily bother you more for the following 48 hours than it did when you came in. And that's just because the source of the pain is outside the tooth at that point.
And do you expect when you go in for the root canal, is it basically you're in and out in a day? And most people are probably back at work the following day.
Most people back the next day, if not that day.
So again, when somebody has that fear of root canal that I'm going to have this done and I'm going to be out with taking pain meds for the next 2 or 3 days and not going to work, that doesn't happen. No. Rarely happens.
Very rarely.
All right, we are going to play a little game right now. And don't forget, as you are watching, this is your forum. So 737-7587 is the number that you can call if you have any questions about proper mouth care, how to take care of your teeth. If you have something that's bothering you, just give us a call. Dr. Sandlin is here to answer those questions. But one of the things, this is the myth. All right, myth is root canal treatment causes illness.
False.
Okay, so that is false. What made people think that would happen?
Well, typically they may associate an infection that may also happen to have a root canal in it and think that the root canal is the source of that. Infection in the body is a result of bacteria, and as we talked about earlier, a root canal is not necessarily the same as the next root canal. There are different degrees of done correctly to the proper length, the proper density, the proper fill, the proper disinfection. So if you have any questions about the quality of a root canal, that may be something to see an endodontist to check on. I fix root canals on a regular basis that people thought were well treated. An improper root canal can be the source of recurrent infection. But root canals don't cause infection. When we treat a tooth, we're removing any sort of bacterial source that can fuel infection.
Okay, good to know. All right, we are going to take a break. When we come back, we'll take more of your calls. Again, if you're just tuning in, we're talking about your teeth, so the care of and a lot of other things. If you have any questions, 737-7587 is the number. We're going to take a break. We'll be right back with more Open Line right after this.